Cervical spondylosis, also known as cervical osteoarthritis or neck arthritis, is a common condition that affects the joints and discs in the cervical spine, neck. It typically develops as a result of wear and tear on the cartilage and bones of the cervical spine over time, often due to aging, repetitive strain, or injury. Here's a detailed explanation of cervical spondylosis and how it can cause referred pain to the shoulder. Anatomy of the cervical spine. The cervical spine consists of 7 vertebrae, C1, C7, stacked on top of each other, separated by intervertebral discs. These discs act as shock absorbers and provide flexibility to the spine. Facet joints located on the back of the vertebrae help stabilize the spine and allow for smooth movement. Degenerative changes. With age, the discs in the cervical spine can degenerate, losing water content and becoming less flexible. This can lead to the development of osteoarthritis in the cervical spine, causing the formation of bone spurs, osteophytes, and narrowing of the space between vertebrae. Mechanical compression. As cervical spondylosis progresses, bone spurs and degenerative changes can lead to compression of spinal nerves or the spinal cord itself. This compression can occur due to the narrowing of the spinal canal, stenosis, or the foraminal canals through which spinal nerves exit the spine. Referred pain to shoulder. When nerves in the cervical spine are compressed or irritated, they can cause pain that radiates, referred pain, to other areas, including the shoulder. The specific distribution of pain depends on which nerves are affected. In cervical spondylosis, pain often radiates to the shoulder blades, upper back, and down the arm. Typical symptoms. Besides shoulder pain, individuals with cervical spondylosis may experience a range of symptoms, including neck pain, stiffness, headaches, often originating from the neck, weakness or numbness in the arms or hands, and tingling sensations, paresthesia. Aggravating factors. Certain activities or positions may exacerbate symptoms of cervical spondylosis and referred shoulder pain. These can include prolonged sitting, repetitive neck movements, lifting heavy objects, and poor posture. Diagnosis of cervical spondylosis and associated shoulder pain typically involves a thorough medical history, physical examination, and imaging studies such as X-rays, MRI, or CT scans. These tests help assess the extent of degenerative changes, nerve compression, and any other spinal abnormalities. Treatment for cervical spondylosis and referred shoulder pain aims to alleviate symptoms, improve mobility, and prevent further degeneration. Conservative treatments may include rest, physical therapy, pain medications, muscle relaxants, and corticosteroid injections. In severe cases or when conservative measures fail to provide relief, surgery such as discectomy, laminectomy, or spinal fusion may be recommended. Prevention. While cervical spondylosis is often a natural consequence of aging, certain lifestyle modifications may help prevent or delay its onset. These include maintaining good posture, practicing neck-strengthening exercises, avoiding excessive strain on the neck, and adopting ergonomic workstations and habits. Overall, cervical spondylosis with referred pain to the shoulder is a complex condition that requires a comprehensive approach to diagnosis and management, involving healthcare professionals such as orthopedic surgeons, neurologists, physical therapists, and pain management specialists.